Up in hospitals nationwide, emergency rooms are hiring pharmacists to oversee the medicines they give to patients to cut back on errors.
We've been talking about this with CBS 19's Risa Morris this morning. Risa, are we seeing this at our hospitals here in East Texas?
Actually, Melissa, we are. Trinity Mother Frances has employed 2 clinical pharmacists to work in its ER, and the hospital says that this will only add to the quality of patient care in its emergency department. We hear it all too often. Incorrect medicines given to people when they need it most, in the ER.
I've been given one that did counteract with the other and caused me some dire problems. And I called the pharmacist and they said, oh yes, these shouldn't have gone together.
Trinity Mother Frances is trying to combat that exact problem by hiring pharmacists to work in the emergency department.
Taking it to that next level and being in that top 10% of hospitals across the country that have actually physically put pharmacists and clinically trained pharmacists in the ER is something that, we feel pretty strongly about.
Clinical Director Jennifer Hay says this will make sure patients are getting not only the correct medication, but the correct dose as well.
To be able to make sure that we're giving the right medications, the right dosage, based on patients' weights, based on patients' age, and what's appropriate for them on what other medications that they are taking. So it is essential for patient care and continuity of care to have a collaborative team like we're going to have with having a pharmacist in the ER.
Trinity Mother Frances is the only hospital in East Texas adding the pharmacists.
Our goal is to make sure that we're in line with those best practices and really taking it a step further and being on the cutting edge of that.
These pharmacists will be joining the hospital team in August. They will be there during peak ER hours, which are from 9 a.m. to 9 p.m.
And they'll be playing a very important role. Risa, how are medications overseen currently in the ER?
Right now, pharmacists look over all prescription orders placed through an online website, but with pharmacists physically in the ER, they'll be able to talk to the patients and give them more information on the medicines.
All right, thank you, Risa. Doctors say that errors occur in almost every fast-paced environment like the ER, but they hope the pharmacists will be the extra pair of eyes to prevent them.
Trinity Mother Frances hopes to eventually add pharmacists for 24 hours a day, 7 days a week to their facilities.